Happy Tuesday, everybody. Thanks for joining us here on Wake Up Charlotte to Go. I'm Ben Thompson along with Sarah French. And today we have special guests that are joining us from Burke County. We've got Dr. Mike Swan, Superintendent of Burke County Schools, and Dr. Karen Otten, Assistant Superintendent of Burke County Schools. Thank you both for coming on and chatting with us. We appreciate it.
Yeah, thank you guys for having us. We're excited.
Good morning.
We are talking COVID in the classroom, something we talk about a lot here, both on our little digital show, but also on air as well over on Wake Up Charlotte. So if you have any questions about it, any comments, let us know. You can leave your comments and we'll try to get to some of them. But I know we've got a bit of news with you all this morning, in that I know your school board voted last night to keep a mask mandate in place. This has been something different districts have been grappling with on and off for the last couple of months. It's the new normal for us. I think Cabarrus County decided to make masks optional. Give us some idea of some of the thinking about go ahead and keeping that mask mandate in place.
Of course, as you know, it was a 5-1 vote last night, but just based on some of the information that we've received from our health director, our numbers in Burke County are definitely declining. Our positivity rate right now is 5.6%, down from last week, which was right around 6.1%. So we are very hopeful within the next month that we as a school system, we're actually seeing very low numbers across the board for our quarantines and positive cases as well. But we as educators, we're not here to say if a mask works or a mask does not work, but we're following the quarantine guidelines when it comes to the mask. And our main priority is to educate our students here in Burke County. And we cannot educate them if they're home on quarantine as effectively as we can if they're face-to-face. Last year at this time, we were on remote learning across the board, K-12. So we're very fortunate to have started face-to-face on August 23rd this year. So we're doing a really good job of trying to keep our students face-to-face right now rather than keeping them at home.
So you touched on some of those cases, and we had this, in the news, cases spiked in late August with 180 cases, nearly 900 in quarantine. Last week you had just 10 cases, 81 people in quarantine. Is this where you want to be, or where are you? What's your goal here?
Of course, it's a hard metric to follow after talking with the health director. There's no secret number. I guess what we could call on is just right now we just want to make sure that we're implementing all the protocols that we need to, and masking and social distancing have seemed to work. And we kind of have equated it to remediation. If we're remediating our students and we find a skill that's working, we don't pull that skill away from them. Then that student's going to continue to fall backwards. So that's kind of that balancing act that we're working on right now.
You're both pretty new to the job that you're currently in, and you're coming in at a strange time, I'm sure, to be an educator. Dr. Otten, I'll ask you, what are some of the biggest lessons you've learned just in the last few months of teaching, but not only teaching, but teaching and running a school system in a pandemic?
Well, I think the biggest thing that Dr. Swan and I have found is how important it is to hear from all of your stakeholders and making sure that we take into account the voices of the parents, the voices of our teachers, and listening to our school board as well and our community. So I think we've learned and done a pretty good job of doing that. Yeah. But that's been an essential skill that we've had to develop.
And last year we focused a lot on grace during the pandemic. This year it's grace and getting back to learning is the main focus.
So I'm a parent, I have 2 kids. And of course, a lot of parents worried about that learning loss. You touched on that. Districts like CMS, they're creating programs to help address some of that learning loss from the pandemic. What are you guys doing to help get kids caught up and make sure they don't get behind anymore?
So that's a great question. We actually have identified with our instructional coaches priority standards, and so that we're helping our teachers really hone in on which standards are essential from the previous grade level, the current grade level. We're also looking at adaptive programs that adapt to those student-specific skill needs. And so they're able to work to fill in the gaps that's specific to their learning loss. And we're also looking at some programs to pull in some other folks to reduce class size and teach in small groups so that we can really address and hone in on those skills that we've missed along the last 18, 19 months.
Of course, before and after school tutoring, all of our schedules, K-12, we have remediation time built into those schedules, whether it's called paw time, pride time, different pullouts where our students can get remediation or enrichment during the school day.
I want to talk about, we've had sort of parallel problems over the last year and a half in a lot of school systems. You have the pandemic itself and the learning problems and the virtual learning and everything that comes with that. But then you've also had a lot of problems filling jobs and positions and job vacancies, and whether that's bus drivers or it's school teachers. And we've seen this across districts, across the greater Charlotte area and the Carolinas. I think as of this morning, you guys have 23 job vacancies. Where do you stand right now on filling some of those?
Right now, we're of course actively engaged in looking for employers or employees. Several of those positions recently came based on the 40-day ADM. We didn't want to go over our class size numbers, so we were able to post several jobs to reduce our class sizes and not have to sign waivers for the state. So that's several of our certified positions. Of course, we need bus drivers, cafeteria, custodial, clerical, just like every other district. But I do feel that we're in great shape. We've got a good talent pool here in Burke County. Our school board approved 30 substitutes last month. We're working on incentive bonuses for our substitutes. So we're trying to incentivize a little bit for people to come back to work.
And we've also provided an incentive bonus for all of our employees, anywhere from the custodial staff to principals to directors. They've each received a $1,000 bonus, and we're looking at doing the same thing again in the spring, just to hope to retain some of these folks and recognize the hard work that they've put in over the past 19 months during this pandemic.
We do know the Pfizer vaccine could be available for kids 5 to 11 within the next month or so. What do you guys plan on doing? Are you going to encourage the vaccine? Are you going to have clinics or access for kids? What's the plan there?
We'll be meeting with our lead nurse, Ms. Miranda Michaels, and our health director, Danny Scalisi, and with our local hospital as well, and come up. Last year, we donated, or we opened up several of our schools for vaccination clinics. And we've also had several student clinics this year in the age group from 12 to 16. So we were able to get several students vaccinated either right after school or on half days. So we've got a great community partnership with our local hospital and our health director.
And I think we'll take a parent choice standpoint on this. We'll have it available for parents that want to have their child vaccinated, but if they don't feel comfortable, then that's totally their right as a parent.
You've seen scenes all across the country, and in fact here in the Carolinas, sometimes these school board meetings getting super heated and parents getting super upset, whether it's about masks or something else. While we have you, and we know as parents will watch this, not even just live right now, but perhaps later in the day on their lunch break or tonight once they sit down, what would be your message to parents out there?
Honestly, in Burke County, our parents have been phenomenal. We've had quorum in our meetings. It's just great interaction. Of course, we encourage parents to come and speak. We want to hear from our families. I've got an open door policy. Dr. Otten has the open door policy. Just the behavior at our school board meetings, we're following the policy set forth, and everyone's very compliant, respectful. And after the meeting, we share stories, and we still know each other. We're friends within the community. It's just because we have different views doesn't make us against one another.
How do you think the pandemic has changed education for all of us?
Well, I think from a teacher's perspective, I think, I'm trying to find the silver lining here. I think it's really forced our teachers to grow and to learn and to be more flexible educators and to learn specific skill sets in remote learning and virtual learning. And they've got all these bags of tricks in their toolbox now that they didn't have before. And so I feel like in some ways, the pandemic has forced us out of our comfort zone and forced us to look creatively and find different ways to reach kids.
Dr. Mike Swan, Dr. Karen Otten, thank you both for coming on. We know you're really busy on the job doing important work, and we appreciate you taking time to chat with us this morning.
We thank you for the opportunity.
Thank you so much. We appreciate it.